Hello, my name is Denny Hong, and I'm currently serving as a missionary in Kindu Adventist Hospital in Kenya. Yes, we have one dog. His name is Maxwell, or Max for short. He's a 1-year-old German Shepherd puppy. My favorite local food is sukuma, which is basically collard greens. Oh, they're actually sweet here. It's because we pluck them right when they're really young, so they're really tender and they don't taste sour or bitter. They put a little oil, onion, garlic, and then they fry them. So Kenya has 47 tribes, and there are a lot of different languages. The tribe that we live in is called the Luo tribe, and then the predominant language is Luo. I speak some conversational Luo. So right now is a morning time. It's 7 a.m. So we say good morning, which is Oya ore. Usually when I ask my patients how they're feeling today, I would say something like, how are you feeling today? Which is Iwinjanade kawono. How are you feeling this morning? I had some like private tutors give me lessons when I first came, and then I've been doing a lot of self-study and learning on my own. We like going on a safari with our family. That's always nice. Going out there on a drive and spending time in nature, seeing the animals and hunting it, looking to see the different type of animals that we can find. There's a lake near here that's really nice for us to go to as well. There are a lot of flamingos and different birds. So we, take out our binoculars and try to find as many birds as we can. Next to mountains for climbing and for doing trails. We got really, really close to a rhinoceros, like within 5 feet of a rhino. So that was like very, very startling. And we have some monkeys in our backyard, and we have a lot of like native birds here on campus too. So when I first came here, I had to learn like everybody's name and who everybody was. And for me, I was the only visitor, so it was easy for them to remember me. But I had to learn all like 300 of them and their faces. So I would frequently confuse all of them with each other. So my family and I moved to Kenya in January of 2021. So we're coming up on 3 years now. We have 3 children, David, Abby, and Sophia. They're 10, 9, and 7 years old. My wife, Jayan, she's working as the chief financial officer here at the hospital. I didn't always know that I was going to come to Africa to be a doctor, but I really enjoyed serving people who were vulnerable, who weren't able to receive care. Like even when I was in medical school and residency, I enjoy working with refugees, with immigrants, and with homeless patients. So I really, really resonated with providing service with people who were otherwise unable to afford care or have access to care. So I think that's what really helped us decide that we wanted to serve abroad in a resource-limited area. I think because our family was young and our kids were pretty young when we first came, they didn't have much of a problem fitting and adjusting. They, were really good at making friends early on, and now this is their home. So, they're very, very comfortable to the environment, the setting. Raising kids in Kenya in some ways is easier because we don't have as many worries. Like I don't have to worry about security, and then there's a lot more support. There's more kids around the area. It's a nice community, so I can rely on my neighbors to help us. And then they have a lot of, yard space and things outside to do. So there are a lot of things for them to do. Our parents try to advertise and try to help as much as they can by raising awareness of what we're doing in Kenya. So they've gotten church members involved. And even though our church is relatively elderly, there's a lot of elderly members who can't travel. They still like to support and keep updated on what's going on. And they send their donations here and support different projects. So it's been really nice. Yeah, my parents try to come out once every year to come and see us and see the kids, and they stay with us for like a month or so. So the hospital that I'm working at is called Kindu Adventist Hospital, and it's the largest and oldest Adventist mission hospital in the country of Kenya. Kindu Adventist Hospital started as a 6-bed clinic back in 1925 and has now expanded to a 170-bed level 4 teaching and referral hospital in the country. The hospital offers various services that include maternity, labor, delivery. There's a pediatrics ward. We have general medical wards. We have an ICU. We have a dialysis unit. and there's diagnostics lab, imaging departments. We have a surgical department with 3 theaters. Well, we call them 3 theaters, but in the US it's known as operating rooms, so 3 ORs. And then we also on campus have a training center for nurses and clinical officers, which is equivalent of a PA back in the US. So we have several part-time consultants that come around, like the pediatrician, we have surgeons and OB-GYN doctors, and then me. Our permanent staff, we also have medical officers. So they're the equivalent of GPs, 4 of them, and then they ward on all the rounds, they see the patients, and they're available for any like nighttime calls. But a lot of our doctors are actually locum, so they're part-time. They come a few times a week. When I first got here, maybe 3 years ago, 1 month in, we had a child who was bitten by a snake, was brought in. And in the US, I really don't have a lot of experience with snake bites. We had to really, really load him with antivenom. He was showing signs that he was envenomated. He was showing signs of like toxicity, those things. So treating that it made me feel like I was really like a missionary doctor, like a bush doctor taking care of like snake bites and stuff. So when we first came to the hospital, we noticed that a lot of the equipment and the way things were being done was very analog. For example, in our X-ray department, they had a Kodak machine where they would take an X-ray and then develop the film in a dark room. They would hang up the pictures and wait for them to develop. And so then, when we came, we realized that we should probably go digital. So we were able to actually use the Alumni Association fund and the donations to get a digital X-ray machine, which has made all the difference. Now we're able to get pictures quickly and wirelessly through our computer system. We can send it as a PDF through our phone. The patients can get it emailed or sent to them in their email, and they can access it anywhere. The quality of the image is really, really nice. The pictures are crisp, and you can see a lot of different things that you wouldn't be able to see before when they were just, hand rolling out the films. Before we came, the only imaging studies that they could do was an X-ray. So after we came, we decided that we really needed to advance the diagnostics department, which is having reliable imaging and expanding that department. So we were able to, with the support of the Alumni Association, get an ultrasound machine, which has been really, really helpful. And now we can diagnose a variety of conditions and different diseases. We can diagnose appendicitis, we can diagnose thyroid disease, we can diagnose infections, we can check up on cancers, we can check all the sizes of the organ, make sure the kidneys are okay. So there's a lot that can be done with an ultrasound machine to see if the patient is healthy and diagnose different conditions. So that wasn't the first project. The first project that we took on when we arrived was getting patient curtains established in the wards in the hospital. We noticed that it was one huge room and there wasn't a lot of privacy. So people would be bathing, people would be eating, sleeping, and there was no curtain separating them. So we wanted to maintain some dignity for patients, especially as they're going through difficult times. So we put in like a curtaining system for the wards in the hospital. In 2022, we noticed that we needed more cash generation and we needed more means of getting revenue. So we had an idea of opening a commercial retail pharmacy. So that's something like having a Walgreens or one of those freestanding commercial pharmacies here in the community. The goal of that was to not only provide really high quality medications for patients so that we can earn extra money for the hospital to serve the needy patients who can't otherwise afford care, but it was also so that we can serve it as a community health center. We can promote ideas of community health, lifestyle health, and as a center of evangelism for ministry. So that's been working really, really well for us. So we had built an entire new pharmacy building. We chose an area of land that was on our property, and we constructed a building. Inside we put a consultation room, there's a cashier's office, there's a small store where we can stock supplies and inventory, and then the main large store where we have shelves and cabinets. It's like any business. As soon as it was built, it took a while for us to start earning some money. We had to do advertisement, marketing, and some things to help promote the pharmacy, but now it's on track, so it's doing well now. So in 2023, Loma Linda's Medical Auxiliary Association was able to give us funding and help donate equipment for a needed ICU, and that included ventilators, cardiac monitors. It included the ICU beds and infusion pumps, so we can really provide good quality critical care services to a much needed community. And it's been really helpful. Now we're able to save a lot more patients who are really sick, who otherwise wouldn't have been able to receive care. The equipment that was purchased through the funds is completely brand new, and it was stuff that we did not have before. So we had to learn how to use them, train our staff on how to set those things up. But it's been really, really helpful. Please continue praying for our hospital, that each one of our staff will be able to show the love of Jesus to our community and be the hands and feet of the health ministry here as we provide compassionate care. Thank you so much for your support, all the alumnus of Loma Linda University, for your help, for those of you who have supported us through different projects. Thank you so much.